Hello all, welcome to the Pathophysiology lecture series. Today I want to discuss about the rheumatoid arthritis. So we know earlier also we discussed about the autoimmune disorders. One of the important autoimmune disorder to the joint is the rheumatoid arthritis, where we'll see the swelling of the joints due to the autoimmune disease. So generally rheumatoid arthritis in a short name we used to represent as RA. So it's a systemic autoimmune disease. It is to be characterized by the inflammatory polyarthritis. Usually affects peripheral joints, especially the small joints of the hand and feet. Particularly the small joints means these carpal, metacarpal, and the in a case of feet we call as a tarpal and metatarpal. So these are all the four important small joints affected by the rheumatoid arthritis, and it will come under as a chronic problem, and definitely it is a long-term problem and need effective therapy to manage the problem. So rheumatoid arthritis is a chronic untreated inflammation may lead to the joint erosions and joint destruction. So joint erosion and joint destruction is the key characteristic feature of the rheumatoid arthritis problem. Particularly because of this destruction and other, we are seeing the deformities also. Because of deformities, we'll see jet type deformities and swan neck type deformities. Okay, in the hand and feet. So when we see the general details about the rheumatoid arthritis is a very common disease having a peak incidence in the third to fourth decade of life, particularly when you are in an age range of 30 to 40. There is almost high risk to get the problem, and particularly this risk is almost 3 to 5 times high in females compared with the males, and the condition has a high association with the human leukocyte DR4 and human leukocyte antigen DR1, and particularly the familial aggregation. These are all the very important risk factors for the high incidence and prevalence. The onset of disease is insidious, beginning with a prodrome of fatigue, weakness, joint stiffness, and particularly we'll see vague arthralgias and myalgias. Okay, and pain and swelling is the very key interesting key parameter of the problem. Particularly we'll see the pain and swelling in symmetrical pattern, where both hands and both feet will uniformly affected by the problem. So that is the one important point. When in a case of osteoarthritis or other, we don't see the problem development in a symmetrical pattern, where mostly the osteoarthritis or other problems, spondylosis, they may mostly in a unilateral pattern, and approximately 20% of patients develop rheumatoid nodules located over the extensor surfaces of the elbows and fingers. Particularly, we'll see in severe cases where nodule type of formations will be on the both elbows and fingers, almost which is like a lipomas, but this is entirely different from lipoma nature. And almost about 80% of cases they may have a seropositive rheumatoid factor. Rheumatoid factor is a one important feature in the diagnosis also. Whenever we suspect this symmetrical pain and swelling of the joint, particularly hand and feet, and where some patients may explain about the nodule type of formulations also. We'll go with the serological investigation of rheumatoid factor, and almost in 80% of cases we'll see a positive result. Okay, and this rheumatoid factor is to titrate, levels are elevated in certain unrelated diseases too, such as viral hepatitis, cirrhosis, sarcoidosis, and leprosy. That's why careful correlation of the seropositive result with the radiological abnormalities is very important in the diagnosis of rheumatoid arthritis. Particularly, we'll see the radiological abnormalities like narrowing of joint space, ulnar deviation of the fingers, and radial deviation of the wrist. Okay, these are all the key features, and particularly in a case of biochemical investigations, we'll see anemia. Mostly it is going to be normocytic and normochromic anemia, and we'll see elevation of the erythrocyte sedimentation rate, and another important factor is the leukocytosis, mild elevation of WBC also called, so, and hyper gamma albuminemia. These are all the biochemical features of the problem, and extra articular manifestations also present, but they don't produce that much severe symptoms. And okay, when coming to the etiologies, majority of cases diagnosed with rheumatoid arthritis, the etiology going to be immunological factor. Maybe some triggering factor, something will stimulate this human leukocyte antigen, and from there we'll see the uh, development of the autoimmunity reaction. Okay, the human leukocyte antigen, we also call as HLA system, is a complex of related proteins. Generally, it is encoded by the major histocompatibility complex in humans. These cell surface proteins are responsible for the regulation of immune system. So whenever there is some problem or missignaling in the human leukocyte antigen system, it may lead to the activation of autoimmunity process. So that is the very key and important factor in the rheumatoid arthritis. Okay, and particularly we'll see two types of possibilities. One is immunological derangement. Second one is the triggering factors. Okay, in a case of immunological derangement, where this role of immune process is going to be very crucial, and where this autoimmune mechanism may start, that initiation of autoimmunity process may lead to the development of the rheumatoid arthritis problem. In that, the very important step is going to be detection of the circulating antibody, we also called as rheumatoid factor. In majority of cases, we will see this activation of rheumatoid factor, and because of this rheumatoid factor activation, we'll see more and more production of IgG and IgM antibodies. Okay, and these things may lead to the antigen antibody complexes, where this IgG, it may react with the autoantibody, we also call that as an antigen. Okay, so that may lead to the activation of process, and further it is going to be the presence of other antibodies such as anti-nuclear factors, antibodies to collagen type 2, and antibodies to the cytoskeleton. So all these plays a crucial role, and antigenicity of proteoglycans of human articular cartilage is another key parameter in the immunological derangement of rheumatoid arthritis. So particularly we'll see the presence of gamma globulin and IgG, IgM in the synovial fluid. So these are all the key factors indicates the autoimmunity process is in active mode. And later level we'll see the more and more production of the amyloid proteins, and they may accumulate in the joints, so that we call as amyloidosis. Okay, and in a last level, where activation of the cell-mediated immunity as observed by the presence of numerous inflammatory cells in the synovium. Particularly we'll see elevation of CD4 T lymphocytes and some other type of macrophages. Okay, so all these levels will increase in synovial fluid. So these are all indicators there is the autoimmunity problem. So in this mechanism, clearly you can see any stimulus or any factor, it may lead to the active lymphocytes. Whenever the synovial B lymphocytes are activated, which automatically activates the plasma cells. Whenever the plasma cells are activated, we'll see increased production of the immunoglobulin G, and these immunoglobulin G production may lead to the more formation of the anti-immunoglobulins also. These anti-immunoglobulins, these are all considered as an antigens due to the autoimmunity mechanism, or due to the missignaling of the human leukocyte antigen. So all these things will lead to the formation of the antigen antibody complexes. That's why we'll see the more formation of the immunocomplexes like immunoglobulins plus anti-immunoglobulins. So generally all these antigen antibody complex mechanisms will take place in the synovial fluid or in the synovial cartilage. So where in a synovium we'll see more activation of the T lymphocytes. When these T lymphocytes are activated, automatically we'll see more production of lymphokines, and in a later level we'll see the local inflammatory processes and the stimulation of the synovial cells. So okay, because of this local inflammation and stimulation of synovial cells, it may lead to the more panus type of formulations, where you can see abnormal mass formations, and finally all these things will result in the damage of the cartilage. So this damage of cartilage finally will lead to the deformities in the joints. Okay, these deformities are very important and crucial in the rheumatoid arthritis problem. Okay, so where you can see here also, because of the more antigen antibody complexes in the synovium, that may lead to the more activation of complement system. Because of complement system activation, we'll see inflammatory responses. Because of inflammatory responses, release of proteolytic enzymes, production of cytokines, more CD8 plus cells production will be there. Okay, these are all going to be an important issue in the problem. As I said, in a rheumatoid arthritis problem, there are the two phases. One is the uh, immunological derangement. Second one is the triggering events. So the triggering events, like as I said, some stimuli, maybe any infection or anything may also activate the process. So that may act as a triggering factor, particularly the infections like mycoplasma, Epstein-Barr virus, cytomegalovirus, or rubella virus. So all these things will activate the process in a synovial fluid, and because of these things we'll see the initiation of the autoimmune reactions. Okay, so this is a process where the genetic susceptibility, particularly these MSC class 2 proteins, where they may more responded to the antigenic stimuli. Particularly these antigenic stimuli may be anything, as I said, mycoplasmic or Epstein-Barr virus, cytomegalovirus, or anything, or environmentally triggered factor also. So all these things may activate the antigenic stimulation process. Because of that thing, we are seeing the T cell activation. Because of T cell activation, more CD4 T cells production will be there. Because of CD4 production, inflammatory cascade process is activated. Because of that, we'll see cytokines, particularly tumor necrosis factor alpha, interferon gamma, and interleukin 1. All these cells production will be there. Because of more production, we'll see the activation of endothelial cells. Because of activation of endothelial cells, there will be more release of the adhesion molecules. Simultaneously, these inflammatory mediators may activate the plasma cells. Because of plasma cell activation, we'll see more anti-IgG antibodies that may act as a rheumatoid factor. So in accumulation, we'll see macrophage activation also. So ultimately, the cytokine activation may lead to the release of more adhesion molecules, activation of macrophages, simultaneously activation of the rheumatoid factor through B cell activation. Ultimately will lead to the formation of the immune complexes and inflammatory cells. So we also said as a panus formation. Because of all these things, we are seeing the deformities in the synovium. Okay, so that may lead to the destruction of cartilage, bone, and finally that may lead to the development of the joint deformities, and finally all these things will be considered as the rheumatoid arthritis. Okay, so as I said, we are seeing different type of deformations in rheumatoid arthritis, and these deformations are the key features. This is the one important swan neck deformity, and here you can see this is a ulnar deviation of the finger. Generally we'll see as a jet deformity. So these are also where you can see mixed type of deformities in a upper limb, swan neck and ulnar deviation, simultaneously a deformity of thumb. Okay, jet type deformities all are there. Okay, so here also you can see this is a cock-optoid deformity. Okay, and these are all the different extra-articular manifestations also we are seeing in rheumatoid arthritis: systemic, musculoskeletal, hematological, lymphatic, nodule, and oscular type. Okay, so that's about the rheumatoid arthritis. Thank you.